Hello, my name's Dr. Ron Daniels. I'm the founder and Chief Medical Officer of the UK Sepsis Trust and one of the Vice Presidents of the Global Sepsis Alliance. And I set out on this journey to improve outcomes from sepsis whilst maintaining a responsible stance to antimicrobial stewardship many years ago. Now, apologies that I couldn't join you live. I am, as you can probably tell, in a clinical setting today. And I'm an intensive care consultant, and I know only too well the current impact of antimicrobial resistance. The public and our governments have heard the message loud and clear that antimicrobial resistance is on the rise, and we've seen Lord O'Neill's report that suggests that if we don't act now, then we're going to see millions more lives lost by the year 2050. But 2050, to the public, to today's children, is a long way away. And that's why it's critical that we use the patient voice and that we use advocacy to get the message out to our public, to our media, and to our governments. Because as everyone here today knows, sepsis is also here today. Several months ago, I treated a young man, a long-distance lorry driver from Poland, who fell unwell with sepsis whilst in this country. His sepsis was caused by an infection that was with a multi-drug resistant bug. And this bacterium with which he was infected was sensitive only to a single antibiotic, one of two antibiotics that is currently being supported by the NICE subscription model. Had we not had that subscription model, had we not had this specialised commissioning for antibiotics, I wouldn't have been able to use this antibiotic. Poland would have lost a young lorry driver and 20-30 years of taxation. 2 children would have lost their father, and a wife would have lost her husband, all as a consequence of antimicrobial resistance. More recently, I was on duty in the intensive care unit, and 50% of my patients, I counted, had infections with multi-drug resistant organisms, some of them sensitive only to the very last resort antibiotics. So antimicrobial resistance is of course here today. It's here in large numbers, and the message that the government, that the public, our policymakers, that the media need to hear is that this could affect someone you love tomorrow. We need to tell these stories. We also need to talk about inequality. In the UK and in many other countries, there is inequality even in antimicrobial resistance. In our large cities in the UK, we know that in areas of low socioeconomic deprivation, 30 to 40% of E. coli are resistant to first-line beta-lactam antibiotics. But in areas of high socioeconomic deprivation, increased population density, poorer access to healthcare, often poorer diets and lifestyle choices, together with multi-generational living, the risk of antimicrobial resistance is double that. It's 60 to 80% among community-identified E. coli. We have to address these inequalities. And finally, we have to address antimicrobial resistance in all of its facets. And to do that, we have to be brave. Yes, this is about clinician prescribing of antimicrobials. Of course it is. Prescribing in primary care and general practice in countries that have that, and in secondary and acute care. But it's about so much more than that. It's about the behaviour of our public in antibiotic-seeking behaviour and in the grey markets where antibiotics are freely available without prescription. We have to also tackle this. We have to tackle environmental contamination with antibiotics. And yes, this does occur in areas where there's runoff into rivers from intensive farming, but it also occurs because hospitals are dumping thousands of tonnes of antibiotics or antibiotic contaminated waste into our water systems every single year. We of course need to think about the inappropriate use of antibiotics in intensive farming, as well as every other inappropriate use of antimicrobials. And to finish, yes, of course, this is also about the antimicrobial pipeline, but a critical point that's often forgotten is the diagnostics gap. The pace of development of the science and technology behind diagnostics that can help me to identify pathogens rapidly, give targeted antibiotics, or identify those patients who don't need antibiotics, that rate of development is accelerating at a far greater rate than our healthcare system's ability to integrate those diagnostics. By bridging this diagnostics therapeutics gap in healthcare systems, we can go a long way, along with all of the other strategies I've mentioned, to maintaining a responsible stance to antimicrobial stewardship and slowing but not stopping its spread.